Subscribe to our YouTube channel and press the bell icon to receive latest updates and stories. Coronavirus has consumed much of our resources, our energies, and at large our own. Without your backing, this pandemic would be like going to war without soldiers, fielding bombs at empty bunkers, and having snipers but missing targets time and again. This pandemic has served to tell our generation that healthcare is too serious a discipline to be left in the hands of politicians alone. In this war against COVID-19, we have lost our civilians and our soldiers, especially those with comorbidities and other illnesses who have got exposed and unfortunately succumbed to their illnesses. We have been exposed to how accountability and integration stands at the very heart of human development and the consequences of not doing so. Many powerful voices today have argued that lack of investment, inefficiency, and investment insufficiency have placed the world at unacceptable risk for our modern age institutions. Institutions have been blamed, countries have been blamed, and at times even governments. They must be held accountable for every bit for putting you through a tireless and terrible situation our age has witnessed. As months pass by, nations around the world have yet again pinned it on hope, which only healthcare providers across the world can do. You may be a treating clinician, you may be a community health physician, you may be a public health professional, you may be a nurse, an epidemiologist, an allied healthcare provider, you may be a researcher, you may be a healthcare technician, or anyone working in the discipline of healthcare, directly and laterally. Please remember, no matter who you are, where you come from, what language you speak, or what religion you practice, you are doing a very important job on earth at this crucial hour. You are, in fact, doing God's work on earth, and I remain a proud admirer of you and a participating actor in the missions. I talk to you as a free child of this world, as a global citizen who believes in One Health, and since I am not bounded by diplomatic niceties or protocols, it is possible that I can speak my mind to talk about the constituency of the neglected sector of healthcare. Friends, we represent one planet. We aspire for a common future, a more inclusive well-being that represents one destiny. It is therefore necessary and urgent to rebuild this destiny together. Many governments have not focused on healthcare because healthcare was never an election agenda, and we have a moral obligation to make it one for all of the ages. The problem of hubris, not investing, not listening, and most importantly, not learning to put the acts of governance together have led to the fruit of lockdown and quarantine, internal frustrations that many souls go through, and also to an economy in free fall. As healthcare workers today, we continue to witness this insanity in futile submission. The pandemic is our moment to mainstream healthcare around the world, make it a diplomatic priority, enkindle a new spirit of health, of responsibility, of service, where we force governments to resolve and to work more harder to not just build communities, but also to build healthcare workers all around the world, ensure their safety, and create a world-class public hospital in spite of all limitations we face. This is not a project of a decade, but a mission of a lifetime. which, if we start now, coming generations will be grateful because we lived. Just imagine how beautiful it would be to witness a new generation of planetary health rise to heights of greatness and splendor, of safety and security, filled with hope and not heartaches. Healthcare must no longer be an ideal inspired by one leader, one nation, one agency, or one non-government organization. The future of healthcare must be defined by a moral collective of stakeholders as diverse as can be and as small or as big as can be, provided they have the mind and heart and the willingness to work hard. I hope that all of you who have this great advantage to be an healthcare provider in this darkest time of our life will continue to do what you do with much greater fervor and mark your contribution on this planet. It is a matter of special privilege to add beauty and inject hope through healthcare in the lives of everyone, everywhere around the world. Every patient provides us with two questions. What can we do for the patient? And the second, what can we learn from the patient? The manner in which healthcare has been conducted through organized chaos around the world to counter the pandemic has raised many important questions to which only you, my dear colleague, can answer. You hold in your mortal hands the power to save lives, celebrate freedom, abolish divide, and build equity and equality through a new and renewed social collective. Healthcare has never been stethoscope and pills. Thus, it should be viewed from a social, commercial, legal, and importantly, an endemic determinant of healthcare perspective. Healthcare has the roots of origin in medicine, in culture, in race, in spirituality, in economics, in physics, chemistry, and certainly biology. It cannot be de-linked with anything on earth, and therefore, in my opinion, you become the most celebrated person of our generation. Remember, you may never get an Oscar award. You may never again feature on primetime news stories. Your government may disown you when you retire, but you will live in the hearts of people, in the minds of men and women who respect and see you as a beacon of hope. As a healthcare provider attempting to build communities as a social collective, I have personally stumbled on every block, faced number of hurdles, seen many disappointments, but the courage to keep going is found in the eyes of those who have no smile left to offer at the end of the day. The inspiration to do more is found in embracing and creating a healthy society who does not know how to do it, how it must be saved. The feeling of doing something for the most vulnerable is something I really cannot put into words, but only rather appreciate in the remembering. It was evident that someday medicine had to become a science which worked to prevent diseases than to treat them alone. This day has arrived. 2020 is the year which should change the way medicine is seen, viewed, and approached. The entire world is obligated to take interest in preventive healthcare and public health. We, as healthcare providers, are entrusted to heal the world and organize public health in the most magnificent way possible. Remember always, the pride of serving a country and her people is more important than mere income. The gratitude of people who go back from the doors they entered the hospital is much more permanent than anything else. Let us recognize that people in communities and patients in hospitals have been our greatest source of wisdom and learning. And we also have a moral obligation to give back to those very people from whom we learn. If you don't want to be forgotten after the pandemic gets controlled, thanks to your own hard work, then you must do more than just treat patients. You must volunteer. You must mainstream the agenda of healthcare. You must raise your voice in solidarity, not with political leanings or undertones, but by pushing the governments to act responsibility always and forever. Our aspirations on earth are common, our future certain. In the interests of humanity, our generation must see the world liberated, and we must achieve affordable and universal health coverage in our lifetime. May we rise as one army to fight the battle against disease and death. Our time is now. Thank you very much for listening. And if you like this message, don't forget to share it with your colleagues in healthcare. Until next time, signing off.